health. I know your ears were burning, Tom, when they were talking about all the times they got inspected over there at Carabao and Moses. So, welcome to the show. Good morning again, Tom.
Good morning, Chris and Sabrina. Good morning to you all.
Good morning.
Let's just jump right into it and tell us as we saw more businesses being allowed to open and the easing restrictions. I guess it started few weeks ago. What has your division at environmental health been up to? Been pretty busy, right?
Yes. So since the declaration of emergency, a lot of our efforts and focus, our resources has been directed toward to ensuring compliance with the executive order or the guidance document that have been issued by the department. So we've been quite busy. And to answer your question, you're right. Our inspection numbers have increased because, as I mentioned before, majority of our resources have now been focused on response to the pandemic. Granted, we have some other environmental health activities that's still going, but generally, our focus has been the pandemic, and rightfully so.
And so, having said that, and how the Division of Environmental Health has ramped up its inspections for COVID-19 and also still doing the sanitary inspections, are you finding a lot of businesses, restaurants not following guidelines for COVID
That's an
that would
interesting question,
support
Sabrina.
the continued closure of, like, for example, dine-in?
Well, first, let me respond to your original question in terms of our findings of our inspection. So you're correct. We've been doing sanitation inspections as well as the enforcement for compliance for the executive order. And when we first started the inspections for like restaurants or bars or other eating drinking facilities, we found out in terms of sanitation, the compliance has been better, and we believe it's because the focus has been at the time on the takeout and the drive-throughs, and not the dine-in. So I think that a lot of the focus was placed on that, which allowed them to increase their sanitation. In terms of your second question, as to have we seen any changes into compliance? Was that the question, Sabrina?
Right. Have you seen it based on your inspections? Does the data support the continued closure, for example, of dine-in
Well,
at restaurants?
Right, sure. The decisions of closures and openings, restrictions, and allowances, that's based on the medical component of it. We participate in providing technical assistance and, of course, the enforcement. So I would have to defer that to our colleagues of the medical side of public health to possibly answer that. But we do provide them our daily documents, our findings. So we do provide that to them.
Hey,
So, but are you seeing any violations at all, like major violations, when you do
Well,
the COVID inspections?
sure, right. So it's not uncommon to find non-compliance. That could be anything from not having a plan to not maintaining social distance. Of course, we give them citations, and overall, there've been more compliance than non-compliance. But all it takes is one event or one individual who break the requirements to possibly cause an outbreak. So whether it's several, few, we take all non-compliance seriously and handle accordingly.
Tom, can you give us a little more detail on some of the infractions and violations you guys are seeing with this current lockdown and the outdoor dining specifically?
Right. So I had a feeling you'd ask that, Chris.
Yeah.
So we do compile data, and I have it in front of me, but this is only up till the 20th of September. So I don't quite have the data for the recent easement of the restrictions. So, but I can say since March when this started until toward the end of September, we visited over 3,000 establishments. Now, that doesn't equate to 3,000 inspections because some were either closed or they were in compliance. So of the close to 3,500, around 70%, there were health regulated establishments, meaning those that we normally regulate with those because they have a sanitary permit, and the remaining 1,000 or so were non-health regulated establishments, those that do not have a sanitary permit. So of that total number, we actually conducted 1,260 inspections, both health regulated and non-health regulated, for both sanitation and COVID. And most of the violations, and this was shared with you before, was had to do with not having a plan in place, as well as other things like not maintaining social distancing or having a plan for frequent cleaning for high-touch surfaces. So we do come across violations, but a lot of them are actually corrected on site, except those that they couldn't, like not having a plan. So they need to submit that as soon as they create one, and we do follow up.
I thought businesses had to submit plans to public health.
Absolutely, they're supposed to submit to us in advance. So there are times when we go up and they don't have one, or if they do have one, they may have not submit to public health, or they just have yet to create one, but they are actually implementing the policy, but may not be written.
So
Depends
Tom,
on the situation.
if the governor says, for example, tattoo parlors or hair and nails allowed to open, that's not good enough. They still have to submit their plan to public health.
Right, and that serves one for us. For example, what we do is prior to we do our inspections, we review the plan, so we have an idea, familiarize ourselves with their SOP, if you will, then ensure they follow it, and if there's any deficiencies, we point that out. So it's kind of like a part education, part enforcement, but 100% seeking compliance.
You said before you do your inspections, you review their plans?
Yes.
So
now,
then when you...
we've received, I'm sorry, go ahead, Sabrina.
I was going to say, so then when you go there and you find they don't have a plan, I'm confused.
Right, so we cite them. It's a progressive enforcement. Just because they're in violation of one or two requirement doesn't mean that leads to automatic closure or suspension. There's a process in place, and it depends on whether they're health-regulated establishments or they're non-health-regulated establishments. So depending on the situation, but it's a progressive enforcement.
No, I mean, like, so you get their plan. You said you look at their plan before you go out and do the inspection, and then when you get there, you cite them for not having a plan.
That's correct.
Is it a different plan from the plan that they submitted that you reviewed before you went and did the inspection?
Well, that's the thing we also look for. It's possible they may have not followed a plan, or they improved upon the plan and just didn't submit an updated one. But ultimately, when we're there, is we want to ensure that they do comply. And if they need to update or revise their plan, then of course we encourage them to do so.
Right, because anecdotally, we've heard stories about businesses, classifications of businesses that were given the blessing to open by the governor, and then talking 3-4 days later with a friend, oh yeah, we were waiting for our plan to get approved. So on that note, daycares, right? They're allowed to open today. Are daycares opening, or are they still submitting the plans? Or are there plans they submitted before good for this opening?
Okay, so we're not requiring that they get our approval prior to opening. We just simply request that they submit their plan, because we will look at them as we do the inspections. If they were to wait for a response, it may be a while because, it takes some time to review these plans, and it's not our point to delay their opening. The governor issued an executive order allowing them to operate. We simply ask them to prepare a plan, submit to us, and we'll review them as we inspect them. But there is a guidance in place as to what needs to be in place for these plans. But definitely we're not asking them to wait for approval, because that may take some time, and it's our plan to delay their operation.
Right, so the Division of Environmental Health, you guys are really frontline, and your responsibilities, it seems, have doubled, because you're not only doing the sanitary inspections, you're now doing these COVID inspections. How many, inspectors do you guys currently have?
Right. So on any given day, we have up to 8 field personnel to conduct compliance inspections or enforcement of the COVID. But that could be reduced down to 2, depending on the priority for the day. Like I said, we still do other COVID-related activities, like when we respond to COVID-related consumer commodities that are detained by customs at ports of entry. We have to respond to that and to go through the procedure for that. And there are other environmental health activities that we've been recently opening as well, like our issuance of health certificates and sanitary permits. Right. And don't forget, we've had another outbreak last year, and that was the dengue. So our mosquito program, when necessary, they do respond, and that's kind of a semi-active program as well. So we have implemented what's called a COOP plan, which is the continuity of operation, where we focus on truly high critical programs, environmental health, and allow those programs to operate whether in fully state or semi-state.
So 2 to 8 inspectors, you said, from within the
Yes.
Division of Environmental Health to go out and about and inspect all of these different facilities, businesses, restaurants on Guam?
Correct.
Wow.
So, and I mentioned this as well, that we truly do appreciate and rely on the public to keep us informed. If they see violation, we ask them to report to us, and we are out in the field every day, every night, 7 days a week. So we're out there the whole day, every day, essentially, just about, to help respond to these complaints as well as our priorities for the day.
Did you guys inspect any churches this over the weekend?
No, we have not. We're focused on the complaints that we've been receiving, as well as the most recently opened facilities like the cosmetic establishments.
And so you did it. You inspected some hair salons, nail salons. What did you find?
Actually, we did. You know, and it was commented during your earlier conversation you had. The executive order did come out, as I recall, Thursday or Friday, and our guidance didn't come out until sometime later. So there's some time for transition period, which businesses I understand would take some time to comply. And I think the one thing that we come across was in terms of cosmetic establishment, was the additional measure that we required them to implement, which was the face shield in addition to the mask. So I think that was one thing that we come across. And you know, we work with our people that we regulate. So we either tell them to either find the face shield, or allow the temporary close until they can get one, then try to open them up as soon as possible. So we do our best to be accommodating, because we do understand the challenges this is imposing to
Right.
everyone.
Yeah. Tom.
Yeah, I was going to say, how fair is that, though, for the governor to make the announcement that, okay, so you guys can open, and then you don't, say businesses are preparing to open, and then all of a sudden public health issues their guidance like a couple days later, and it's, oh, you can open, but you have to follow these guidelines, right? So why aren't the guidelines coming out before the announcement that they can open, so these businesses know what exactly to do before they open? Reopen.
You know, I don't wish to comment on behalf of the governor's office. Or,
No, but you
the
see what I'm
park's
saying,
allowances.
though?
Yeah.
You see what I'm saying? It just seems like it would make more sense to have the guidelines out.
So you guys follow the EOs. It's not like there's any kind of concerted, hey, this is what I'm going to do. What's the guidance going to be? It's more like, oh, then EO came out. Oh, we better get some guidance.
You know what I mean?
No,
So-
we're given advance notice as to the general opening, what's going to happen, but it's the detail that could be a challenge. And for example, this recent one that we issued in 2020-041, this is not just a simple work of Division of Environmental Health. This is almost the entire department. We had to go through this carefully, the first draft and the final draft, to ensure it met everyone's expectations, and not just the environmental component, but the medical component. So it does take time. In fact, I believe this is completed like midnight the day before. And granted, it took a while to get it out, but it took a while to review it as well and prepare it. So it's been a challenge for all around, I believe.
Yeah.
Yeah, but you do understand where businesses might be coming from when they're like, well, we can open, and they prepare to open, but then guidelines come out X amount of days later, and then it turns out, well, maybe we can't open because these guidelines are so strict that we can't meet them. So I'm just wondering, is public health going to, maybe change this, or have any conversations like, hey, Gov, can we get the guidelines done first? So these businesses aren't left hoping that, oh, we can open, and then it turns out 2 days later, oh, damn, we didn't meet these guidelines, these new revised guidelines.
Yeah.
It just kind of makes sense.
Yeah, of course.
Fair question.
Maybe it
That's a fair
doesn't.
question. And I can only respond to our Division of Environmental Health. As soon as we're notified, we start the draft, the technical component of it, and prepare the original draft, send it out for review, then review and finalize it. And we try to get this out as soon as possible. And we really do mean that. We work on this sometimes the entire day to ensure that the expectations of the executive orders, the requirements, the mandates are reflective. Our guidance documents reflective of the executive order.
Tom, we know you guys are working
Yeah,
hard.
I know. I mean, I feel for you.
But what are you going to do, though? You said only 2 to 8 inspectors, on any given day. Are you guys going to get any more? You guys going to hire?
Well, yes. Well, we just lost one to resignation, which is unfortunate. She was
What
one of
happened?
our senior staff. Uh, she actually got picked up by U.S. Food and Drug Administration, so she went to greener pastures
Damn
over.
feds.
She went to the feds.
You
She
didn't
went to the
match her.
dark
You didn't
side.
match her salary. Oh, girl, what? We got
Well,
that. All right.
no, it's a terrible loss for us. But we wish her the best. We really do. In fact, anything, I think it's a reflection of our staff for FDA to actively seek out one of our staff and to recruit
That's a
this
positive way
individual.
to look at
Good
it.
spin there. You,
It really
you need
does.
to transfer to Adeloop.
And I think we contributed to a success in that regards. So Guam has much to be proud. We have one of our staff who's now part of the FDA team, doing exactly what we're doing on a federal level
Nice.
for food safety.
Tom, just go ahead.
But
Go ahead.
yes.
Go ahead. Go ahead. No, finish. Sorry.
we do. We had a recruitment for 4 vacant positions, and so we just finished the interview process. So hopefully, we'll be able to fill all 4 positions pretty soon.
Tom, just going back to the cosmetic establishments, you mentioned mask and face shield. Who wears the mask and the face shield? It's the attendant.
Question.
Yeah. Okay. Just
It's
so the
the
public knows, 'cause I feel like
Sure.
we really try and get the guidance out there and how it's supposed to be, but it's an avalanche of information. So I just want our people to know, like, when they go get their hair or their nails did, that they go in with a baseline understanding of what these businesses are supposed to be doing, so that they can observe and say, okay, well, hey, you're supposed to be doing that. You know what I mean?
Yeah, absolutely. The way the executive order and also the guidance document that supplements that is that the person who actually is working on you, if you will, cutting your hair, if you will, that person must be wearing a mask and a face shield as an extra precaution.
All right. Well, thanks, Tom. Any parting words of advice to businesses out there or the community?
Basically, the message that we've been sending out to everyone is that this is a community effort. It's not just a public health issue. It takes everyone's effort, especially the people, to practice social distancing, to wear the mask, and don't go out unless you absolutely need to. And if you do go out, take necessary precautions and follow all the guidelines that we issue and the recommendation that we provide.
And where do people call to report something they see is not in line with COVID guidelines?
Yes, there are 2 ways. They can contact by phone, which is 300-9579, or through email, dphss-deh@dphss.guam.gov. And that's also in I believe, our guidance document as well, our email and our contact number.
Tom, a lot of these, with the churches or the businesses that come on the link, they are kind of saying a lot of the same things nowadays. In that, we went through the first lockdown. We've learned so much about the virus in the last, 7 months. And so they say this and they couple it with this idea that, oh, we know what to do to keep each other safe. So just to appease or not appease the public, when you guys and your team go out there and you're inspecting what's currently open now, is it safe? Are the businesses for the most part and the employees following those protocols that we need to follow to make sure people don't catch this virus?
So the question, is it safe? I believe that's a question we need to ask ourselves individually. Everything is relative. There's nothing absolute. So I guess you have to ask yourself, well, where am I going? What am I going to be doing? When I'm there, is it safe to participate in the activity, or whether we getting a haircut or whatever, or go shopping? What we do at Public Health is we provide restrictions, guidance to help individuals make that decision. So I think a lot of them is a personal decision, but at the same time, it's a collective decision. As I mentioned, it's a community effort. We need everyone's participation, everyone's involvement, and everyone's adherence to the guidance and executive order to protect the entire island of Guam.
Tom, before we let you go, we had a comment here from one of our people online, and hopefully you can provide clarification on whether businesses can open outdoor dining without a special outdoor license.
Well, first, they have to be in the right category. When I say that, the sanitary permit we issue is based on, because keep this in mind, it works in tandem. The requirements of our, like the Guam Food Code, which is our safety code, the provision in there that applies directly to COVID mitigation, everything from hand hygiene to cleaning and disinfecting or sanitizing. So they go hand in hand. So if you have a sanitary permit to operate as a eating, drinking, and it's for dining out, you have to have the right category. In this case, like for example, you cannot be a bar and have dining outside because first, that's not your category, and your specialty is or priority or focus is not serving food, it's alcohol. Right now, it's to dine outside. So if you're a restaurant, you may do so. Is there special requirements or license? You know, as long as they meet the food code and our general guidance, I don't see us enforcing. I can't speak for other agencies. I'm just speaking for public health, environment health. We just want to ensure that they comply with our current requirements. And if they wish to have outdoor dinings, of course, we encourage that. If they decide to rent or lease property nearby and expand their operation, you know, I don't see why we would prohibit that, provided they also meet, like I said, our food code requirements and they meet the category.
Okay, so for restaurants, if they want to pivot to comply with these guidelines, they can open outdoor dining without a license to do so for outdoor
No, as long as they
dining.
meet our, correct,
Okay.
at least with us, as
Okay.
long as they meet our requirements, they're good.
Right.
Okay.
That's interesting, Tom, because you see a lot of these businesses. Like I thought some businesses were just bars, and now it's like, oh no, we're a restaurant. So it's interesting to see how people pivot and try and work around all these different restrictions.
Right. So you have to be like it's in the right category. You can't be a bar and transition into a restaurant because when you obtain your sanitary permit, you were not permitted as a restaurant because you did not meet all the requirements. You're operating as a bar.
Right.
Now, a lot of them probably can
Right.
if they transition, but you know, the way their facility's set up or their focus may not be conducive for serving food, and that can be a challenge in terms of food safety. So that's where we come in and issue the right permit.
I think what we're going to see in the near future is a lot of these places that were just strictly bars are going to start up in their food game. You know, like places like I guess Horse and Cow, right, is one where they serve food and they're a bar, but they're serving food.
As long as they meet our requirements, that should not be a problem.
Right
You
on.
do have to meet requirements.
All right. Thanks, Tom.
Thank you, Tom.
Thank you. Not at all. Thank
Appreciate
you
it.
guys. Be safe.
Yeah, you too.
You too.
Wash your hands.
I sure will.
I know.
Thanks, guys.
Yeah, the wrong guy to say wash your hands.
I
to,
know.
right? He's like, yeah, I was watching him the whole interview.
I'm on it.
8:24. We'll take a short break, and we're back with more of the Link on the Breeze. 93.9. Good morning.
GU Self Storage, conveniently located near the Harmon McDonald's. We offer a